Okay, so today we're talking communication for dentists, and there have been many requests to highlight this topic in a video, and that's what we're doing. So let's dive in. So the first part of our journey of communicating with a patient is, of course, when we call them in from the waiting room. And it's very important that we build up this rapport as we walk them from waiting room to surgery. That kind of little walk can serve as a way to soften the mood. You can talk about the weather, you can talk about how the drive was to the surgery, and what this does, it sets a calm tone for patients so they kind of feel more at ease and less thinking about the clinical side that may make them more anxious. So they will start to perceive you more as a human and less of a doctor who is far away. So you get closer to them, and that will serve their oral health and their compliance much better in the long run, but also in the short term. And I'll explain how that will kind of come to fruition during the appointment. So when we take the next step, they get in the room. Ideally, you want to keep control with them. They need to be in control, right? So instead of ordering them to sit down or, to have a seat, I would say, when you're ready, feel free to make yourself comfortable, or please take a seat in the chair. And that kind of, you move away from commanding tones. And in that way, you're empowering your patient, basically. You're giving your patient the control whether, they want to sit in the dental chair, or maybe they're not ready to sit in the dental chair. And I've seen a few patients like that. They feel the dental chair is too intimidating for them, and instead they want to have a one-to-one chat with you while they're sitting in a regular chair. And that should be fine as well. That should be part of what you do. It should be part of what you offer patients. Now, secondly, the offering of choice and perceived control. A part of that is how far do we go and recline the chair? And of course, it has to be workable for us. So we can't just say to patients who say, I want to sit upright. Well, there are limitations. But of course, to some extent, we can try to accommodate. And what this does, again, is it gives patients more of a sense of control. And the more patients feel that they have control over what's going to happen, over the situation, the easier the treatment will go. The more compliant they will be during treatment, and the more likely they will be empowered enough to make an informed decision about what type of treatment they wish to proceed with. And we'll get to that later on. And before you start drilling, before you start injecting, before you even have a look during a checkup, just say, look, is this okay? Is the chair position comfortable? Would you like me to change anything? Give you more of a neck support, maybe? And these are all meant to allow the patient to be as at ease as much as possible. Now, we know that, of course, despite all this, patients will experience some anxiety. So in order to deal with that anxiety, first, it's important to confirm what is the patient actually coming in for, right? Sometimes patients think, I'm coming in, I have a treatment plan that involves fillings and root canals and crowns and periodontal treatment, and they think maybe they're coming in first for the crown. And you have in your plan a simple filling, just as a start. But they think, well, the tooth is broken down, so I need a crown quickly because you mentioned that you need a crown quickly, so that's what you're going to do. So aligning what you want to do or what you have planned doing with what the patient came in for, their perception of what they're going to have treated, is very important here. And as a result, you won't be doing something the patient isn't agreeing to. It's as simple as that. So, and if that means that I need to re-educate the patient, then maybe we put the patient back up and say, well, look, maybe there is a bit of confusion here. Maybe I need to talk you through the treatment plan again, right? And that's one option. The other option is maybe the patient really prefers you start with a certain treatment. So maybe the patient insists on doing that treatment because it's urgent for them. That's fine, as long as it's okay within our dental profession. So from a professional perspective, everything needs to align as well. Now, if you notice the patient is anxious, it's important the patient feels that you've seen that you know that they're anxious, because that's already half the treatment, right? That's what's going to calm them down. So acknowledging that they're anxious and then dealing with that. And we'll talk about that later on. So next step is to state the duration of treatment. Mrs. Smith, we're planning on doing a crown prep. We went through what the crown prep involves, and I'm going to numb you up first, and then I'm going to shape the tooth in a certain way so that we can take an impression and prepare it for the crown. Then we take the impression, and then I'm going to put a temporary crown on. And then we'll see you 2 weeks or 3 weeks later for the permanent crown fit. All of this during the first session will take 1 hour or 90 minutes. And that will allow the patient again to be more in control, right? So they know what to expect. And the fourth element is to promise a stop signal. So if they are in pain, or if they want to swallow, they want to close their mouth, they need a toilet break, anything, right? Agree on a form where the patient can get you to stop. That can be by raising a hand or by, making a noise, not shouting or screaming, but, just a simple noise is enough, right? And that's kind of an agreed format where you agree with the patient when to stop. It's important to kind of establish these 4 elements before you start, because these are kind of the rules of engagement, and you will find that actually patients very much appreciate this way of carrying out treatment. Try it, right? Next patient tomorrow, go through these 4 and see, and do it with every one of your patients that comes in for treatment. Don't do it for checkups yet. Just do it for treatments and see how patients respond to this. I think your patients will very much appreciate this. Mine definitely do. Then there are some studies showing that you can do a few exercises, a few changes to your pace, to your pitch, your tone, your tonality, and your kind of the way you breathe. And all these will actually contribute to patients' trust in you. So what do? You do a 3-step breath. You breathe in gently, you breathe out. And what this does is it allows the diaphragm to use its maximum capacity to allow air into your lungs. And that immediately reduces your breathing rate as well. Immediately, you then become a bit calmer. And when you're calm, your patient will be calm. And your energy that you kind of transmit to your patient will be an energy of calmness. No anxiety, no drama, no panicking. Everything is in control. And when everything is in control, you don't need to raise your voice. Your tone goes down and your pace goes down as well. Right? Why? Because you're not rushed. You have everything under control. You've done this 1,000 times, 20,000 times, whatever. Yeah? Even if you've done this 100 times, that's quite a lot, right? So you're in control. And when a patient sees that you're in control, they'll trust you more. But you can't expect a patient to feel that you're in control without you sending those nonverbal cues. And it's very important that we send out these messages to the patient. So next, the patient is actually in the chair and we're trying to convey some message. One powerful way is, and we had this actually in Holland, we had on the LED light, we had a mirror and patients could actually see what we were doing. And some patients appreciated it, others didn't. And I think most patients actually felt this was quite a nice innovation. But alternatively, what you could do is you could say, well, here is a mirror and you can see what I see, right? The other way of doing it is by taking pictures, right? We have the technology nowadays. You can use intraoral cameras and all you need to do is just buy a £200 or $300 intraoral camera and plug it into your laptop or computer and start taking pictures of people's teeth. Now, after the examination, you can share your findings. And that's very powerful because patients really appreciate visual elements of the process of discovery, right? So you need less explaining. If you have visuals, you don't really need to explain much. If you have an open cavity or you have a crack in a molar and a lot of wear and tear on an amalgam restoration, or even leakage in a composite restoration, or a cusp has fractured, or you can start to see cracked tooth syndrome, then it's much easier to convey the message of, look, something is going on here as a first message. So you don't go straight into the solution yet, right? And I'll get to that. You start by highlighting the problem. You need to really take your time to talk about the problem. And you can reduce talking about the problem if you have visual evidence. And that can be an X-ray, but it can also be images or a CBCT scan. Then once you have taken an X-ray or an image or a scan, what is important is that you share your findings, your visual findings, with the patient. And it's important to have that on a screen. It would be ideal if the screen is big enough so that the patient actually can see with you. And you can point where the problem is, right? See, there's a dark area there, and see there is some decay here on the picture. There's a crack here, and there's a broken element here. And you have, for example, one tooth with 3 different fillings, and those fillings are not really working together. So see, there's some marginal leakage between the fillings, and it's all not really conducive to good oral health. Or for example, you're getting a food trap there, and the patient says, oh, I didn't notice. Well, look at the periodontal probe. It goes in like 5-6 millimeters, and you can take pictures of that. You can show the inflamed gingiva and all kinds of ways to illustrate what is actually happening. And this is all about highlighting the problem. And allow for the patient to take that in, right? You don't want to just rush straight to solutions, right? You need to make the patient problem aware and give the patient time to absorb that this is a problem. One aspect, and this is what I found very important in my daily practice, is that you have to make the problem relevant to the patient, be it their health, be it their daily life. And there is often a disconnect between what we see in a mouth. Let's say we see a caries lesion and the patient not being in pain. So that disconnect creates potentially a problem because the patient may think, I'm not really having an issue, right? What's the sense of urgency here? And you're like, well, if you wait long enough, you'll lose the tooth, or you'll need a root canal treatment, or, things will happen. A tooth will fracture, you'll get problems. You'll be in pain, you may get a swelling, And the problem here is that we need to make sure that patients really embrace what we're saying. And until we understand and we get that feedback from the patient that they fully understand what we're talking about, there's no point in providing solutions, because you're going to provide solutions to someone who hasn't even acknowledged that there's a problem. So first step really is you have a problem. What is the problem? Where is the problem? How does it look like? Well, I can show you. This is where the problem is. This is how it looks like. And then how relevant is it? Okay. So I have a patient who has periodontal disease. I'm not in pain. My teeth are fine. You say they've lost bone, but I can't see any problem. And that's where you have to make it real. You have to make what your observations are connect with daily life and oral health as being an important aspect for a patient. Because bear in mind, patients are open to accept a theory if that theory makes sense to them, right? So they're even able to accept a treatment proposal. But again, it has to be making sense. If you don't make sense, then I'm not gonna agree to your treatment. So if a treatment is an absolute requirement, if it's an absolute red, and I understand it's a red, then I need to do something about it now, within a week, within 2 months. But if it's an amber, and you're telling me within a year, Okay, within a year, that gives me some time, right? And the same thing happens with if you bring your car to a car garage, for repairs or for MOT, they will tell you your brake pads may need replacing in 6 months' time. And then you can decide, right? Do I want to take the risk? Do I have time in 6 months' time? You know what? Maybe I want to replace it now. Or I'll come back in 6 months' time. So first, problem. Raise the problem and show the problem. And then make the problem relevant to the patient. So these are the stages of awareness the patient goes through when you're in a dialogue with them. It's a funnel, and this is a business concept used in marketing and all kind of in all fields of where business operates in. So we have first the unaware client or customer or patient, and the patient is just relaxing, in the chair. They came in for a checkup and they have no idea that they have extreme periodontal disease. Okay, let's say they have pockets of 8-9 millimeters all over the place with some recession as well. And they've lost, let's say, 80% of their teeth, have lost 60% of bone. So we have identified a problem. Now it's my task to bring across a message to alarm the patient that actually there is a problem here. So I need to move the patient and help them move from being unaware to problem aware. I do that by aligning the diagnosis with clear and simple language. Make it as simple as possible, right? I see a dark area here, I see a shadow here. What does the shadow mean? Shadow means bone loss. Shadow means decay. Shadow means inflammation, right? Shadow means loss of attachment. What does attachment mean? Attachment is like you have if your tooth is your hand and the gum and bone is the sleeve and it's very tight, and at some point it loosens and you lose attachment, the bacteria and the food gets underneath the sleeve, and you start getting problems with your gum health and with bone, and you start losing more bone, and your jawbone is going to be affected. So all of this communication that is happening at this stage is aimed at getting the patient to understand there is some sense of urgency here. There is a problem. Now, once we've talked about the problem and we get some feedback, and that can be just plain nodding or the patient understanding. So if the patient is still frowning their eyebrows and not really buying into this, then really there's no point in talking about solutions. And I strongly believe that dentists should stop there and talk to the patient about what is it in their explanation that the patient doesn't understand, right? So it's very important that you talk about the problem long enough so that the patient understands that there is a problem and embraces the fact that something is going wrong in their oral health. If you feel the patient is not there yet, just say to them, look, there are treatments available, but I see you're not really convinced that there is a problem. And I would highly recommend at that stage, if there is really lack of accepting, then there's no point in going into solutions unless the patient really asks for, okay, what are the solutions then? And in a patient who is very cynical, I would really keep it short there. Why? Because there's no point in you talking about all the solutions and the products that you have, and they're simply not gonna take it. And sometimes it takes 2 or 3 people to give a patient the same message before they actually are convinced, right? I had cases previously where a patient comes in for a second opinion and they sit in the chair and I say, you're here for a second opinion. And you know what they say? They say, no, this is the 4th opinion. I say, well, okay, let me have a look. Don't tell me what the other 3 said. I'll have a look. And by the time I finish my diagnosis and, start talking about the problem, turns out the other 3 were telling exactly the same story to the patient. And then I'm talking about the same thing and he's nodding. He goes, yeah, I understand. Okay, I'm ready now for a treatment. So sometimes you're only there to highlight the problem. You're not there to treat because the patient will go somewhere else and have the treatment somewhere else. Sometimes you're just a messenger, and that's what you need to do. You need to highlight what problems does the patient have. And if the patient is ready to listen to any solutions, then go ahead and present solutions. Now, let's say the patient says, oh, that's bad. It sounds really awful. In which case I say, well, as we said, right, periodontitis starts with maybe pockets 4 or 5 millimeters, then 6, 7, and you have 8, 9 millimeters with quite a bit of recession of your gums. So you have lost quite a bit of attachment. So yes, the problem is big, but there are solutions. Now, when you talk about solutions, it's important to explain what the solution is away from your products or services that you offer, right? You're not talking about what you can offer, right? You're talking about what a solution could be. So one solution could be extractions. Another solution could be do nothing, right? It's not really a solution, but it's a way to deal with the problem, and then wait long enough, then the teeth will need extraction and then go to dentures, etc. And then the third option, of course, is to treat by a periodontist, or to have treatment by a dentist with special interest in periodontics, or by a hygienist, right? Depending on the skill set and whether, for example, a hygienist can actually get in the 8-9 millimeter pockets. I have seen hygienists who are very skilled at treating advanced periodontitis, and some others prefer to just stay at supragingival and slightly subgingival, and that's a personal preference. You can't blame someone for not wanting to treat a certain case. But if you have no hygienists in your area who treat advanced periodontitis, then either you do it or you refer to another clinician. So we're talking about solutions here, right? Deep cleaning, right? The root surface debridement, and as a first step. And you need to always, of course, if you decide to do it yourself, you need to go and look what the guidelines say in your country in terms of treatment of periodontitis in this case. But this applies to, endo, to pediatric dentistry, to oral surgery, for example, removing a wisdom tooth, right? This is a big thing about removing wisdom teeth where patients have no problems, but I can foresee in 10 years, the 7 will have deep caries and, will need to potentially come out, and then the patient will lose 2 teeth. So there is that conversation that needs to happen. So once the patient says, okay, well, I'm leaning more towards keeping my teeth, right? I don't want to pull teeth. So at some point during the conversation, the patient becomes solution aware, and they should be made ready to become product aware. And then we start talking about what treatments we offer, what the value is that we offer, right? So once you get periodontal treatment, you will be able to have gums that are not bleeding. You will be able to reduce your pockets. You'll be able to stop this disease from progressing further, right? And you will not lose your teeth, hopefully. It requires a lot of effort from your side. It requires a lot of effort from our side, right? It's a joint effort. Periodontitis is not just a treatment that I do as a clinician and you sit back as a patient and, don't take care of your teeth, and in 6 months' time, pockets are open again. So it's important to highlight where patients stand in terms of what value they get, what their duties are, and then you can highlight the price. And then the patient becomes most aware. They are happy with the proposed presentation and they want to go ahead. And that's, I think, the ideal way of presenting treatment plans. And you can apply this to veneers, or you can apply this to whitening and endodontics and any treatment that even a simple filling, right? For simple fillings, the patient is not aware that they have a cavity. I need to make them aware of the cavity. So I take bite wings, I look at the bite wings and I can see some dark on a radiolucency on the x-ray. I put the patient up, I say, look, there is the radiolucency, but you know what? If we decide to open up the tooth, I will also, because the cavity is a bit hidden underneath the enamel, but once we open up the tooth, I'll take some intraoral images and I'll present them to you, right? And that's important as well during the treatment, to highlight, to show the patient the different stages of treatment and to actually reinforce that you didn't do this treatment just to drill their teeth and grab their money. No, there was actual disease going on. And when you drilled, you didn't drill too much or too far or too deep, right? Because that's also what we hear a lot. The dentist drilled too deep, and as a result, my tooth is now infected. If the dentist had taken pictures, the patient would have noticed or would have at least been able to see that it's not too deep. The drilling isn't too deep. Actually, it's very conservative what we just did. We even left a tiny, tiny bit of affected dentine, not infected dentine, but affected dentine, in the deepest parts to avoid pulp exposure. Yet, this treatment proved to not be enough. And in fact, if you can make the argument, you should actually be stating this risk way before treating. So as the patient has been made of the problem, we start talking about you can do a filling, or you can do maybe an inlay, or maybe this tooth may need a root canal treatment. It's like, well, why would this tooth need a root canal treatment? I'm not in pain. Well, then you start explaining the anatomy, the odontoblasts, and of course you'll say, how much time is this going to take? And over time, this will take less time because you build a trust relationship with a patient. So initially, you'll need to make a lot of effort to build that trust relationship. After about 5-10 years, the patient knows you, right? You'll be like, okay, well, here's, again, for the 20th time, the x-ray. Here's a problem. And patients will tell you, okay, I'm going to book an appointment because they trust you. You don't need to go through a lot of this every time with every patient. We're talking about cases where you don't really have much trust yet. Patients who are new to you, but also patients who have been with you, who never had issues, but now need some treatment that is unknown to them. Is a treatment, let's say you have a 25-year-old patient who is never had any treatment and all of a sudden develops, say, cracked tooth syndrome in an upper premolar, right? We see these a lot in geodistal direction, huge crack. So in those cases, what do? He's young, so you try to save the tooth, and he's aware of the problem because he's in pain. So he comes in, in your surgery with pain. And by then you need to really take the time to highlight the problem and make the patient aware of the solutions and the limitations of every solution, of course. And that if the tooth is cracked fully beyond the alveolar crest, then the tooth may need to be extracted. So all these considerations take time to explain, but believe me, one letter of complaint takes much more time, right? You'll be spending 50 hours on resolving that case and the negative energy that comes with it. So by having the right structure in place on how to approach patients who are unaware of their problems, you will minimize complaints and you will maximize your time and your energy, and you'll optimize your time and energy into doing positive things. All right, so the patient has said, all right, what are the treatment options? You present 3 options, right? There's the 3 option rule. Try to always present 3 options. I would not present 4 options because patients usually can take up to 4. There's been quite a bit of research around that. If you present 4 options, it's doable, but try to stick with 3 and, leave out any unreasonable options that are just out of reach. In that way, you kind of really try to focus on the options that are relevant to the patient. So one way of quantifying the risk of disease or the potential of treatment is by talking about per 100 patients, 90 are successful, or per 100 patients, we only get 1 failure, or per 100 patients, most people, let's say 60% of them, can live with this for another 2 years. Right? So that gives patients at least an idea of what to expect. Now, 99% is not a guarantee, right? I always tell patients, so if I tell you that my success rate for root canal treatment is 80% or 85 or 93%, what does that tell you? The majority do heal, and that's a very positive thing. But if you're part of the cohort that doesn't heal, the 20% or the 7%, the quantified figures that I gave you don't make any sense anymore because they're irrelevant, right? So I gave you 93% success rate, you were part of the 7%. Now we have to find another solution. And when I give you again the options of retreatment or endodontic microsurgery or extraction, again, we're going to fall into percentages and, out of 100, how many will heal? But all of this needs to stay within GDC rules, right? So we want to provide factual data. You don't want to kind of alarm patients unnecessarily, right? You don't want to create panic and start saying, if this disease is not treated within a year, 99% of people lose all their teeth, right? If we're talking, for example, about periodontitis. We know periodontitis, in most cases at least, it's a slow progression of disease. And if you notice a fast progression, then it's good to reflect on that. Like, okay, well, a year ago, we took x-rays and we saw your bone was there. And now all of a sudden, your bone is halved. What's going on there, right? And that requires, an investigation and an explanation, especially if the patient has been under your care. So you need to get to the bottom of why this is happening. And again, don't get into very alarming data that are non-factual. So one way of getting increased acceptance of your proposed treatment plan is to talk about the long-term successful outcomes. And studies show that you can actually get 22% more case acceptance. And we're not talking about manipulating patients, right? We're talking about really stating benefits of a procedure, right? If I do this treatment, you'll be out of pain. If I do this treatment, this will fill your gap and you can eat again on the right-hand side. So if I put, for example, 2 implants and a bridge, I will restore your bite stability and you won't have to rely only on the left side to bite. So all of this is important because we want patients to accept, not to fill our pockets, really. Honestly, patients come with a need for oral health intervention. And if we remain ethical, and we have to remain ethical, we should not be selling them or try to sell them anything other than what they need. And if it is something that they would like to have, then we should look at, is this an ethical treatment? For example, if a patient comes in and they have a beautiful smile, but they have a gap in the middle, we need to ask ourselves, what is the best option here? Right? And of course, there will be a lot of arguments about what the best treatment can be. If I say orthodontics, which I strongly believe is the right treatment in this patient's case, a patient young, no periodontal disease, no endodontic disease, perfect oral hygiene, just has a central diastema that can be closed with braces. If someone then comes in and says, well, let's do a quick fix and let's just, remove the enamel and put some veneers on it, I find that is stretching ethics. I don't want to say it's unethical because each case is different. Maybe the patient, really doesn't like the shape of her teeth. Okay, fine. Then there is an argument. But if the shape is fine and it's just a matter of position, then, I find, proposing and selling veneers might not be the right treatment here. So again, you can increase case acceptance by highlighting the positive outcomes. So when we present our treatment plan, we want to really present value. So you want to present value first, and you start with a problem, as we said. Then you show the benefits of comfort, function, long-term oral health, and no pain. And then, of course, you go into step 3 and you highlight what you just saw with visuals. So you show the patient on a screen, X-ray, scan, video, where the problem is, and then you focus on outcomes, the positive outcomes, right? So you want to emphasize the result, not so much the procedure details. Then what you can do is you can say, well, we have treated other patients with periodontal disease, in this case, for example, and look at this case. We saw a similar pattern of bone loss 5 years ago, and we have been able to stabilize this for the past 5 years. And it required a lot of hard work from me as a clinician and hard work from the patient. But with this combined effort, we were able to maintain good oral health. Then present price, because you've highlighted all the value. Then when you present price, you will be able to explain your pricing much better. And that can be a high price, it can be a low price, whatever suits your pricing strategy, right? And we will talk about pricing strategy in a different video, because pricing strategy is often misunderstood. People don't really get the pricing right. Sometimes it's too high, sometimes it's too low. There's a lot of missed opportunities there. And one thing I need to say about pricing is that pricing needs to be in line with the value that you give to the patient, but it also needs to be aligned with your brand strategy, right? So for example, if we want to go on a budget airline, the budget airline will give us a different experience than the business class executive level airline where you fly for, and pay maybe 60 times more. So patients who go for a value, a budget treatment, expect to get a certain level of service. Patients who pay a lot of money expect a different level of service, and the value is different. And it's about how you convey that message as a brand. And you can decide as a brand, as a practice, to go either for, and this is from Harvard Business School's Professor Porter, who came up with 3 main strategies. It's a simple business concept. You either have a low-cost strategy or a specialist strategy. So you become a specialist in something, you can kind of specialize in braces, that's all you do. Or you be a premium brand. And, when you look at cars, right? Kia is maybe budget, specialist is maybe Volvo for like families and safety. And then there's the premium brands like, Rolls-Royce and the likes. What happens to the rest? Well, the rest sometimes gets squeezed in the middle. And for them, it's very difficult to differentiate. So if you don't have a clear strategy that fits within those 3 elements, you'll probably lose patients to a budget practice or a premium practice or a practice that sells a specialist care. All right, so that's that. Let's go to the price shock line. So patient, you've just told them the crown is £1,000 or $1,300, and they say, oh my God, it's too much, I can't afford. And then there are some ways of dealing with that. Of course, you have to empathize. You have to understand that this is indeed, as a clinician, I need to understand that this is a significant investment and that should be communicated with the patient. Like, I understand that this is a significant investment. I just explained to you the value. Now I'm going to explain what this actually means. You could use a reframe, right? You could say, well, over a whole year, if you look at it every day, you're just spending maybe, £3. And it's less than a coffee, basically. It's a coffee a day. And this crown will last you 20 years, 30 years, if you take good care of it, right? And then on top of that, you can add a layer of warranty. And we used to give a warranty on our products. I personally would tell patients, my work, especially like composite restoration, I would tell them last 10 years at least. That's because I had confidence in my work and the work of, that my team would put in. I worked with excellent, brilliant therapists, amazing people who just delivered every day with so much passion and so much care, a lot of treatments to patients, and I'm so thankful to them. And they are part of where I am now, really, where I can share these stories. So you can kind of give a warranty for the treatment that you provide, and that's a point of strength, actually, that you say to the patient, well, look, this is something that I can really guarantee you that will last 3 years, 5 years, 10 years. So then if the price is still too high, you can talk about finance options. And then you really need to leave it at that, and you prepare a quote and tell the patient, look, this is your option. Take the time to think about it and let me know if we can be of any further help. There's not much more that you can do. You explained the problem, you gave them the solutions, you talked about the products that you offer, you gave them the price, you empathized when they told you that it was, quite a high price, and you give them a quote. Now, there are certain ways of dealing with certain cases that I'm going to highlight, I think 2 or 3. One is if patients have a lot of fear, and what tends to happen is if you recognize their fear, they will be calmer, and if you give them more control, they will be even more calm. And if you narrate each step, that will give them at least some sense of certainty, right? You're reducing any surprises, and you become more of a predictable clinician in their eyes. Now, some patients want to say, well, I really want to get a second opinion. And I think if you feel the patient, and I've done this many times, if you feel the patient is, and this by the way, is mainly about the problem aware. If you're at problem aware stage and the patient is really struggling to understand that they have a problem, then I would say, look, this is the problem I've identified. Let me briefly talk to you about what could be potential solutions. You can do A, B, or C, right? With different risk rates and success rates, and but there are alternatives to each other, and these are the options. Then I think it's better if you have a second opinion, because I explained and I tried to explain to you that you have a problem. You're clearly not ready to accept that there is a problem. In your best interest, I would like to prepare a summary of findings and my recommendations. I'll write it on paper, and I'll email you the X-ray. If we have a CBCT scan, I will send you a link to download it, and you can go and have a second opinion, because I really would recommend you have a second opinion than just delay it. Because if you delay it, you'll be back on a Friday evening and request that I do the treatment because you're in heavy pain, right? And I don't fancy that. It's as simple as that. So, I don't fancy it because it's going to come as an urgent case. I don't fancy it because it's going to cost you triple of what it's going to cost you now. I don't fancy it because I don't feel like we should go down that path, because you're going to be in pain. And what's the fun of seeing patients developing disease, progressing further and further, and watching the decline and not being able to do anything? That's not fun. And if you don't feel like I have been able to explain to you to a level where you can actually understand that this actually is a serious problem, then maybe someone else can. So please go and find someone who can give you a second opinion or a third opinion, or in my case, a fourth opinion. So chairside control, you can include every couple of minutes an update. So you give them, for example, the first update is, look, we're halfway through. Or you tell them, we're nearly there. We just have 2 more minutes. Or, are you okay? Are you still okay? And sometimes even thanking them for bearing, for having the patience to endure the treatment. It's a long treatment. I can see you're struggling with your jaw opening, and I really appreciate it. Thank you. Thank you for helping you, basically, right? And it gives patients more control, less uncertainty, and it allows them to see that you're in control as well, right? They're safe, right? You're in control of the situation. You're calm. You know which stage of treatment you are in. Nothing is going off script, right? And patients will be, having less stress due to the increased predictability, of course. So one thing I often do when I kind of, finish treatment, I say to them, we've finished the treatment and everything went well, have a look at this. We've been able to, reach patency, and we cleaned the canals, and I believe we found all the canals that I saw on the CBCT scan. And now the big wait is, of course, for your body to heal, right? We've done what we can and up to the highest levels. And we need to kind of wait for your body to do its work. And I thank them and I praise them for their cooperation, because they need to feel very positive about this treatment. And I want them to feel positive about this treatment. And I want to make sure that they really have a positive memory of this interaction. So I say to them, as I promised you, like there was no pain, you didn't feel pain. Did you feel any pain? Most, by far most, say, no, it was all pain-free. It was the first pain-free treatment I've ever had. I don't believe that, but hey. So if the patient says like, okay, it's all pain-free and thank you. And I say, well, I gave you loads of local anesthetic, but I'm really sorry, like it's all numb now. And it kind of is that compassion, right? So on one hand, yes, I'm the guy who treated them and I'm kind of in charge, as in like I'm the doctor who treated. However, I need to get to patient's level. I need to connect with that patient, feel compassionate for their struggle, for their pains, for their discomfort. And the more I do that, the more I show my human nature, the more patients will think of the whole interaction, including the nurse and the reception and the room and everything, the treatment, as a positive event in their life. And hopefully they can just forget it and it won't stay as a trauma, as a traumatic event in their life. All right, that was all. If you have any further questions, let me know. I'm around, I'm on Instagram, I'm on YouTube, and I'm happy to answer questions. We also run mentorship programs for dentists and we run courses. Feel free to check out. And for some dentists who are interested, we can do discovery calls and see if we can help them out in their journey of becoming better dentists, earning more, living professional lives full of joy and fulfillment. More joy and more fulfillment. Who doesn't want that? Have a great day.